Welcome to phase 10 of the PrescriptFit Medical Nutrition Therapy Strategies. I'm Dr. Stanford Owen, and if you're sitting there with your counselor at your physician's office, we'll be talking about adding beef into the splurge phase of phase 10 this week. Now, to get started, make sure that you fill out your medical nutrition therapy follow-up form. Any basic information that you have, especially your weight and your waist size, which phase of the diet you'll be doing, which is PrescriptFit phase 10, any medication changes that you've had this week or the last 2 weeks, exercise that you're planning on doing for the following week, any, such as walking or jogging or all of them, including swimming and biking and calisthenics and so forth. You can be varied. Environmental cleanup, making sure that sugary drinks, pork, beef, dairy, and starches, wheat, corn, rice, potatoes, are as much out of the house as possible. Any new symptoms that may have, now that you started splurging, we're going into phase 9, which is splurging with pork, now 10, splurging with beef and pork. Do these cause any symptoms to relapse? And if they do, how long do they last? If you get right back on your diet strategy and you splurge appropriately, do those symptoms go right away? You'll make that intuitive, insightful connection between foods and feeling bad. That helps you manage the foods better long term. Any new measures that your doctor or provider may have made, mark them into the worksheet and your plan of action for this following week. This week it'll be phase 10, which is beef, added to your strategy. Environmental cleanup, again, if you are going to eat beef or pork or both this week in your diet strategy, try and leave the house to go look for it. Go to a nice beef restaurant and get the best choice you can get. It's all you can eat, so really make it festive. Exercise you're planning for the week, how many minutes per day? And family trust, is there any more discussion necessary? By this time, hopefully, it will have been discussed enough and your family's really learning that you're serious and that these changes will be permanent and that they're necessary. And hopefully they'll be seeing such an improvement in you, the way that you feel and your health and your medications, that they're now actually encouraging you and cheering you on with this and participating with you. This strategy works for kids, this strategy works for adults, this works for sick people, it works for well people. So really everybody could, should, and will be using this strategy if you persist with it. Any changes in medications related to appetite or metabolism, then hand this back to your counselor for recording. On your calendar, whether you're doing a 3, a 7, or a 14-day strategy. And again, you're splurging now. You have pork and beef into the splurge strategy. So mark those ahead of time where you anticipate. Sometimes they'll just jump out and bite you or some spontaneous event. You'll mark that with a splurge. This gives you not only strategy for how to use food groups, but strategy for planning as well. Really, really simple. You may also reread the section on diseases and symptoms, noting that your symptoms have probably improved or disappeared, your diseases have improved or disappeared, and now they're at risk for coming back depending on how much you splurge. So read the book again to reinforce that. The next phase will be adding beverages. At this point, that is alcoholic beverages. So we'll discuss that next time around.